The 2024 pre-annual election period. What is it? What can you do? What can't you do? And what you shouldn't do during the pre-annual election period. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see along in the video. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. If today is your birthday, then happy birthday to you. A birthday is a new beginning. A birthday is the first day of another lovely year. A year of new tomorrows that is shining bright and clear. A year of possibilities as endless as the sky, and a chance to meet the challenges in everything you try. So when is the pre-annual election period? The pre-annual election period is from October 1st to October 14th each and every year. It precedes, of course, the regular annual election period every year for Medicare beneficiaries, which is October 15th through December 7th. And what parts of Medicare does the annual election period apply to? It applies to Medicare Part C, which is Medicare Advantage, and Medicare Part D, which are the prescription drug plans. It does not pertain to Medigap, or also known as Medicare supplement plans, because those plans are standardized and have been the same for years. They don't change, whereas Medicare Advantage and prescription drug plans change each and every year. They are calendar year plans. And so that's why we have an annual election period and a pre-annual election period, so you can review your options and make any appropriate changes that you may want. So what exactly happens starting October 1st for the pre-annual election period? First, Medicare updates the Part C, Medicare Advantage, and Part D drug plan info on the Medicare website. Medicare also updates their prescription calculator. So I want to give a warning here. Please be careful with the Medicare prescription drug calculator during the pre-annual election period. You may find that there are different results if you wait for the annual election period. And my advice is you can do a comparison, and I do comparisons for people during the pre-annual election period, but I try not to make a decision until after the annual election period has started and run the medications again. Next, the insurance companies update their Part C and Part D plan offerings on their websites. The insurance companies introduce new Part C and Part D plans for the coming year. So if you have a Medicare Part C, Medicare Advantage plan, or Part D prescription drug plan, you will receive what's called an ANOC. That is an annual notice of change. It comes out late September to the middle of October. Most people think it's junk mail, so they throw it away. They don't review what their changes are. And so all of a sudden January rolls around and their premium went up, or their co-payments went up, or their benefits changed, and they didn't know. Well, that's because they didn't read their annual notice of change. So make sure you keep an eye out for it and make sure you review it before you do anything. So what can you do during the pre-annual election period? What I wish they would do is actually get rid of the pre-annual election period, because in my opinion, and I think most agents' opinions for sure, it's a pretty pointless time. Whereas you can do absolutely everything that you want except actually enroll. So what can you do then? Well, you can review your options, and if you need my help, you can certainly review your options with me. One thing that is required as an agent, I have to send you what's called a Medicare scope of appointment form that I need to have you sign and fill out completely so I can review plan benefits with you. This pertains to anything Part C or Part D. It's a Medicare required document that I need to have signed. And in some cases, once you sign it, I have to wait 48 hours before I can go over the plan benefits with you. So if you want my assistance, the best thing I can tell you is to gather all your prescription information, the exact name of the medication, the dosage, and the quantity. If you want my help, I will review your medications and use the Medicare prescription calculator to determine what Medicare says is the lowest overall drug plan available for you and your unique medications. If you have a Medicare Advantage plan or you are considering one, then make a complete list of all your providers, your doctors, specialists, clinics, hospitals, etc., that you see on a routine basis, and by that I mean at least once per year. Then I'll review your Medicare Advantage options to see if you already have the right plan for the coming year, or if there's another plan more suitable for you. I base my recommendations on a few things. First, the drug coverage. You want to make sure that you have good drug coverage for the unique medications and the pharmacy that you happen to use. And it varies from plan to plan and medication to medication. So it's important to check during your annual election period. The next thing I look at is network accessibility. Ideally, what you want to do is, if for a Medicare Advantage plan, is go with a company that has a large stable, nationwide network. Are your providers of choice in the network? Do you need access to a specialty hospital? Those are things that we will talk about when considering a Medicare Advantage plan. And then next is financial risk exposure. This is very important. Most people haven't heard of it. Most people don't think about it, and very few agents will actually ever talk about it. But financial risk exposure is what you are on the hook for potentially if something happens to you seriously. How much are you going to have to pay out in co-payments, deductibles, and co-insurance? And the idea is you want to find a plan that's got the lowest, what we call MOOP, maximum out-of-pocket as possible. The less that you have to pay in a given year, the better off you are. And then lastly are the extra benefits. Unfortunately, it's the extra benefits that they love to market and sell. Did you get this? Do you get that? Am I getting everything I deserved and everything I'm entitled to and all the stuff that you see with all the ads? Those are all the things that they like to market. Let me tell you, that is not the most important part about choosing a Medicare Advantage plan. They're nice to have, but don't base your decision upon the extra benefits. So what can't you do during the pre-annual election period? Well, as I've already alluded to, you can't actually officially enroll. If you happen to have a paper application from the company for the plan, then you can fill that out, but I would advise you not to mail it till October 15th because it could get returned, it could get delayed, something could happen to it. What should you do during your pre-annual election period? Most importantly, you want to look for your annual notice of change. Again, that comes out from late September to the middle of October. And make sure you take a look at that and review what the premium is going to be from year to year, what the co-payments are going to be, and any other mention of benefits to make sure that it is suitable for you for next year. And this year could be very, very important when it comes to your drug coverage because of the Inflation Reduction Act that was passed last year and how they have changed the Medicare Part D. And this doesn't matter whether you have your drug coverage built into your Medicare Advantage plan or you have a separate standalone drug plan. This is especially important if you take brand name or specialty drugs, those that are tier 3 and higher. So please do your due diligence and check or reach out to me for help if you are from one of the states that I'm licensed in. If you only have a Part D plan and you are only currently on inexpensive tier 1 and tier 2 medications, and they will stay that way in the coming year, then unless you are paying more than maybe $20 per month for your drug plan premium, you will probably be fine for the coming year. But if in doubt, please reach out to me for help. If you have a Medicare Advantage plan and you are unsure about the plan's coverage, benefits, and how well suited it is for you, then if you are from one of the states I'm licensed in, please reach out to me and let's take a review of your Medicare Advantage plan and compare it to other ones for next year. What you shouldn't do, really important, what you shouldn't do is answer phone calls from telemarketers and large telesales agencies. If you don't recognize the number, even if it's a local number, don't answer it. And if you do happen to answer it, my advice is don't give them any personal information. And don't be surprised if they may already actually have some. And if they tell you they're calling from Medicare or on behalf of Medicare or behalf of Social Security, or they say they're from Social Security, and you need to change your plan or upgrade your plan or update your plan or anything like that, they are lying to you. Take their name, take their number, do a Google search and see if that number matches Medicare or Social Security. If they call you and say they are with your current insurance company, they probably aren't with your current insurance company as well. Again, take their name, take their number, Google the number, and see if it matches the name of your insurance company. It's even rare for the insurance company during the annual election period to call its members and tell them they need to update their plan. Does it happen? Yes, but it's rare. The times that would happen, they would have already sent you a letter notifying you of some plan change that you need to be aware of. So don't call or respond to those wonderful Medicare, get what you deserve ads on TV, YouTube, Facebook, the internet, or even direct mail. You can see my video that I did specifically about being careful of the 800 numbers. So how would it work if you want my help during the pre-annual election period or the annual election period, or for any time for that matter? You can reach out to me by giving me a call or going to my website and filling out one of the contact pages. Then I will send you an email with an electronic scope of appointment that you need to review, check all the product boxes, click, agree, and then submit it. If that happens when you initially call me, then I can start reviewing options and benefits right away. But if it doesn't, if it happens after your initial call and or you contact me through my website, then we have to wait 48 hours before I can review options and benefits with you. We will discuss and review your current coverage. What do you like about it? What you don't like about it? As I mentioned above, I will need your medication list and the names of providers to best help you. Once I have all that info, I will do a general review of the plans that are most suited for you. Once you pick the one you like or want the most, I will electronically send you the important plan documents, and we will especially review the summary benefits and the plan, also known as the star rating. Then, once October 15th arrives, we will get back on the phone to handle the actual enrollment, and you will be sent an email with a link to verify the enrollment. After that, you'll receive a welcome kit and a card, typically within 7 to 14 days, and your existing Part C or Part D plan will be automatically terminated. And of course, I will be available down the road should you need assistance with your plan or policy. So there you go. Your pre-annual election period. What you should do, what you shouldn't do, what you can do, and what it is and when it is. I hope that you have found that helpful. So pay attention, especially for your annual notice of change. And beware that there are always new plans every year. And drug plans especially change, and this year they could change a lot for 2024. If you have questions, if you need help, please reach out to me if you are from one of the states that I am licensed in. And speaking of states, if you don't mind, in the comment section below, put in what state you're watching from. That does help me to determine what other states that I want to be licensed in. If you happen to live near the Charlottesville, Virginia area within an hour to an hour and a half, and you would like to meet in person at a safe and convenient location, please reach out to me and I can probably work that out. And I want to remind you to please like, subscribe, and share this video with somebody you know. That's it for today. I'm Chris Prang, the Medicare analyst. Make it a great day.